Vaccines save lives. Fear endangers them. It's a message parents need to keep hearing. This quote by Jeffrey Kluger explains the anti-vaccination movement by saying that parents are not getting their kids vaccinated because they're in fear that it causes autism. But by not getting them vaccinated, they are putting their kids at risk of mumps, measles, and polio. In this discussion, I hope to debunk some of the common concerns and myths about vaccinations and why they do not cause autism, and I hope that we can get a federal law in place to require vaccinations from children before they attend public school. There are only state laws right now in place, which means that there is much more room for exceptions. Every state has a different requirement, and there is no consistency in the prevention of infectious diseases in public schools. Some statistics that I have found on this: in the first 6 months of 2011, there were 10 recorded deaths from measles, and this was the largest outbreak since 21 in Minnesota County. And 7 of which of these cases, they were too young to be vaccinated. So that means they were essentially newborns to 1-year-old children that have died from this because they were exposed to an infectious disease of measles that could have been prevented by vaccinating older children. And 10 children last year died from the worst whooping cough epidemic since 1947. So in the time between 1947 and now, we have developed a vaccine that can prevent whooping cough in children, and by refusing to vaccinate your children, you are exposing them to more chances of getting whooping cough. And 10 in California last year have died from that. There were 1,500 parents that were surveyed, and a quarter of them came back and said that they believed that vaccines caused autism. And I will be going over a couple of studies that prove that that is not true, and why doctors need to be reiterating the importance of vaccines in children, and that it will not cause your child harm or diseases that weren't already previously there. Autism does not develop until you're about 2 to 3 years old, so the fact that they had gotten vaccines before then has caused the belief that vaccines are the cause of developing autism, and that's just not true. And the fact that 7 children were too young to receive vaccinations just proves that by not vaccinating your older children, you are putting younger children and even other children that are vaccinated at risk of developing these diseases in schools. So why are parents not vaccinating more likely? They're afraid of autism, like I said, or they don't think that their kids are susceptible to diseases like mumps, measles, or polio because it's not a prominent disease in the United States. And just because it's not prominent in the U.S. does not mean that your child cannot get it, because there are people coming over from other countries, and there's people traveling in and out, and they could be carriers of this disease. And if your child is not vaccinated, they will unfortunately have a better chance of getting this disease. A study done in Colorado involving hundreds of thousands of unvaccinated children proved that they were 23 more likely to develop whooping cough, 9 times more likely to be infected with chickenpox, and 6.5 more times likely to be hospitalized with pneumonia. In 1998, there was a paper that was published saying that the measles vaccine could cause autism, and that is believed to be the cause of the sudden rise in fear of vaccinations. And now when they were questioned about this study, none of them fessed up to any of the information that they have found, and Dr. Wakefield, who was the one who proposed the whole entire thing, has now lost his medical license for falsifying data. So the CDC has shown no link between vaccines and developing autism, and specifically the drug, or thimerosal is what it's called. It's a mercury-based preservative that has been used in multi-dose vials of vaccines studies in the early 2000s have shown that it has no link to autism in the vaccine mumps, measles, and rubella, which is one of the ones you get when you're younger, and it has since been removed from all vaccines as a precaution to reduce the amount of mercury exposure in children. So the main concern was that thimerosal in causing autism, but now it is not in any more vaccines since that time. So there is less concern there in developing autism. That's one of the things that have been debunked, which is good. And last year, which these next figures are pretty astronomical to me, that in California had the largest number of unprotected and unvaccinated kindergarteners to date, which they had not been vaccinated for non-medical reasons. So because of religious beliefs or philosophical beliefs, almost 15,000 kindergarteners had not been vaccinated, which made 49 cases of the measles outbreak until March. So the state had 4 cases by that time last year. So it had jumped astronomically the amount of measles outbreaks because of unvaccinated children, and 4% of kindergartens in Colorado were unvaccinated as of last year. So these are all for non-medical reasons. So you're not vaccinating your kid just because you don't think that they're going to contract a disease, or you don't think that they need it, or it's against your religion or whatever. But 49 cases of measles proves that you need to vaccinate your child for them to be safe. I wouldn't want to send my kid to school and have them exposed to a really terrible, deadly disease like that at such a young age. And it's such a burden to other people to think that their kid is not safe. Basically, we need a federal policy that is going to regulate these vaccinations and show proof of vaccinations before you can attend a public school. State laws there's too much room for exemptions, there's too much room for inconsistency, and if you're in one state and they don't require you to be vaccinated, you can move to another state and possibly be a carrier of these diseases and infect people that are vaccinated, but infants that aren't can gain these diseases. And if we had a federal law in place, I just think that it would be, the entire United States would be regulated, and they would all have one general understanding, and I don't think there should be any exemptions except for medical reasons such as pre-existing conditions that could be worsened by vaccinating, or allergies such as I can't get a flu vaccine because I'm allergic to one of the ingredients. So that would exempt me from getting a flu vaccination, which is not technically a requirement for school, but vaccinations for measles, mumps, chickenpox, rubella, polio, I believe should be required for all children of age to be able to attend public school to prevent the spread of infectious diseases that were once prominent in the United States, that we have worked so hard to get these vaccines to prevent terrible diseases like this to happen, because in most cases the child will die. Their immune system is not strong enough to fight off these diseases, and there's not enough time for them to be treated before it is too bad. These diseases spread way too quickly to way too many children, and with such a small immune system, they cannot fight it off. So on my PowerPoint, there is the timeline for when your children should be vaccinated, and it starts from birth, but the ones that are for flu or measles or mumps don't start until a little bit later. So your child is going to be susceptible, and if your child gets sick because you refuse to vaccinate, can you really live with yourself for that? So I believe that we do need a federal law to regulate the entire United States so that we can get rid of these state laws, because as we know, every state has different laws and every state has different beliefs, but we need to be in one consensus that vaccinations do not cause autism, they do not cause your child more harm than good, and vaccines do, in fact, save lives. So get your child vaccinated as soon as you can. Don't delay the process. You're only harming your child, which would be detrimental to you and your child later on down the road. So, thanks for listening.